All the Health and Human Services meeting to order. We have legislators Elaine Daly and Amy Sargent here. Legislators Bob Shea and Tom Winslow have been excused. So with my presence as chair, we have a quorum. Before we begin our committee, I would like to say the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, first of all, we have minutes to approve August 13th, and I know that with our attendance tonight, there'll be a lot of motions from both of you. So I do need a motion.
I'll second.
Any discussion about those minutes? All right, all in favor?
Aye.
And it carries. Thank you. We go right into department reports. We are going to mix the order a little bit because of some commitments some of our department chairs have. So we're going to hear from department head Brenda Wyman first.
Thanks for doing it. Appreciate it. So I didn't have a report for this meeting, so I'm open to any questions or anything you might have. I did want to, though, comment on a couple things on the last report. One is that we are continuing to get out our farmers market coupons. We've done our staff. I want to give a shout out to our staff because we're allotted $37,000 worth of farmers market coupons, and we're giving those out $25 at a time. So that's quite an effort. That's all the staff are involved with it. Several are going out in the communities, but people are making flyers. People are putting notices in the paper, on Facebook. There's answering calls. There's a lot that goes into it, and I just wanted to bring that to everybody's attention. What a big lift that was and what a great job they have done with it and continue to do with it. And we will have the coupons still at the senior fair. And the state recently authorized us to give even those who've already gotten them this year may get them again, which they've never done before. So I think it's a one-time only thing with this a little bit extra that we've got this year. The other thing that I wanted to just mention, because this is probably the last time I'll see you in person before then, our senior fair is September 24th, Wednesday coming up. And there's just a number of great things going on. We have 64 vendors that will be attending. Our emphasis is always on those that provide services to older adults and caregivers, and those who are local providers of service. And so we have a really nice variety. I also wanted to just remind everybody that the New York State Office for the Aging Director is going to be our guest speaker. I don't believe he's ever been here to Cayuga County in the past. I'm especially excited because we both graduated from Syracuse University together with our master's in social work and our gerontology certificate from the Maxwell School. So I've known him a very long time. We went different routes. I was always very interested in doing and micro social work, and I work in my communities and make sure our community members had services. Greg was always doing bigger and better things, and he's been at the state level now for decades and is just a phenomenal speaker. He's amazing what he can get done. He was the co-leader for the Master Plan on Aging with the Department of Health Director. And there is not anybody who knows the ins and outs of aging services better than he does. So I hope that you get a chance to come out and hear him. So
when directly does he speak?
He speaks at 11 o'clock. Great question. And we believe that we will have the stage in the food court this year for those presentations. So that'll be especially nice. Normally we're in a room, so.
Oh, what did you do? I didn't hear what you just said. You'll have the what?
The stage will still be set up and we'll be using the stage this year. So that'll be nice.
Very good.
Yeah, it's exciting.
Thank you.
A lot going on.
Any questions for Brenda?
No.
Thank you so much.
Thank you. Yeah.
I'm going to continue to mix up the order and ask Deborah Dennis to come up to report to us on the Youth Bureau.
My report is here. I just have a couple of things to add to it. We are excited that we did receive an increase from the state when everything's kind of been going down and funding decreasing. It was nice that OCFS gave us more funding to award to youth programs. I had the applications were due to our office this past Friday, September 5th, and we received 27 applications, which is way more than I've ever received in the 3 years that I've been doing this. So that's really exciting. I've gotten all those applications out to our youth advisory board members to begin to look through. So sorry, I've inundated a lot of you with many emails just to kind of have a time to review those before we get together. Working on some dates now towards the end of the month for the board to get together to vote on the funding. So that's really exciting. Just to let you know, too, last year in 2025, the Youth Advisory Board, they funded 14 programs. So I think we'll be able to fund a lot more programs this year. There's a lot more rural programs. So that's something that we've really been wanting to do, as well as reach out to the smaller communities in our county. So in addition to that, somewhat related, we do have Student Government Day. The planning has gone out to the department heads, and so that will be on Tuesday, October 28th. We're working on the logistics now, but I've invited the department heads all to participate, those who are able. And once I get the list of who's able to participate, then I will finalize everything with the school districts in our county.
Do you remember how many students last year?
We tend to get about 90, 93. It's usually in the low 90s that we're able to get. And that's with, we have 7 school districts in our county. I know last year there was a conflict with the Cato Meridian School District, so they were not able to attend. So that was with the 6 school districts we had.
And it looks like this year, no conflicts, every school district.
Yep, they've all received the save the date. I'm working with Amanda Morgan on the menu and everything at Emerson Park.
So it'll be the same. we
Yeah,
can
same
report to the
format.
same.
Yep.
Okay.
I have a question, Heidi. The 155,000, is that strictly the OCFS money, or there's an allocation for sports, youth sports, or?
Yeah, there's, it splits up into 3 different allocations. There's youth development,
Okay,
there's youth team sports, and youth sports and education.
all in that 155.
All in that one, yes, all in that 155. 15% of that, I have my budget meeting with Lynn in a couple of weeks. 15% of that is allowable to go towards administrative fees. And typically we do take that funding out of that to cover the cost of the administration of the Youth Bureau.
Do you have a speaker for Student Government Day yet?
I'm working
on it.
Right, I'm working on that now, yeah. So if anyone has any ideas.
Are you hoping for a special topic, or, I mean?
No, but I think just I know last, a couple of years ago, I know it's different students. The first year I did it, we had Dr. Durant. Last year, there was an individual from Micron that I think the students really enjoyed listening to, just to kind of talk about different opportunities that might not be traditional and try to keep, the people stay in this area with all the different industry and everything. So I think that was a really,
Yeah.
that had really good feedback I heard from that. All I had.
That's sort of a fun assignment to keep our ears out and think about potential for a speaker. Thank you.
Thanks.
Okay, so now we will start in order. So Christina, come on up.
Don't run up.
Resolutions. And why don't we have 3 resolutions. Why don't we cover those first before?
Okay.
HH1 is authorizing the chair of the legislative Commissioner of Social Services to accept $25,000 in funding from New York State OTDA and enter into contract with CAP.
Yep, so this is for TANF eligible victims of domestic violence that are working with the CAP program. Some of the money of the 25,000 goes to direct support for payments for things that victims need, such as legal aid. It can be non-recurrent expenses, concrete things that they need to get stabilized. And a little bit of the money also goes towards the some of the cost for a case manager in that program.
Does anybody have any questions about the resolution?
I'll move HH1.
I'll second.
Any further discussion or questions? Hearing none, all in favor?
Aye.
Aye. Any opposed? HH1 carries. HH2 authorizes the Commissioner of Social Services to accept Youth Employment Program, YEP, funding, and authorizes the Chair of the Legislature to enter into subcontracts or any subcontracts that are necessary to implement the program. It's a lot of money.
Yep, so 414,000, a little bit over that. This is the second allocation that we have received. And the reason that we have this funding coming into the county is because we qualify for the GIVE funding. So this kind of ties into the whole GIVE program. And the purpose of the program is to provide some year-round opportunity for employment for youth. So an extension of really of the summer youth program that we have had for many, many, many years. Very successful program last year. We subcontracted with in-house within the county with the employment training program through Kelly was here.
Yep.
Yep. So I talked with Kelly today and confirmed that there were 60 to 70 youth that we anticipate serving. That's the number that were served with the last year's allocation.
Similar, I'm sorry.
Pardon me? Same kids,
Nope, same amount of
same
money.
amount of money. It's a little bit more. 14,000? Yeah. $14,000 more is what we got. And Kelly said that that will really be taken up by the increase in the minimum wage. So exciting, 60 to 70 youth to have opportunity for the employment and also to receive the supportive services that come through the program.
And I have some money.
I'll move HH2.
I'll second.
Thank you.
The whole allocation go to employment training? Yep. You don't keep any within the subcontract at all?
Yep.
And you've done it, so is that one of the ones you budgeted for? I'm trying to connect the dots from Ways and Means. This wouldn't be an extra one. This is something you anticipated.
So last year, it was in our budget because we had received the allocation for a little bit less money than this in our budget. So we'll be putting this 414 into our 26 budget.
Okay.
Yep.
Any other questions, discussion?
Just now I'm confused. It starts September 1st and goes through June next year. I mean,
Right, because the summer youth picks up July and August.
okay,
So this program only runs through those 10 months. The 2 months are summer youth, which is a different allocation amount. I come back in for a resolution for that.
but Lynn, can I just clarify it for me if you're there? We don't have to re-accept this money, do we?
26. Is that your question?
Yeah, I mean, we're not accepting it into the budget. It's got to be part of 25's budget.
Well, now if I get the resolution allows us to take in that funding.
And whatever's unspent by the end of the year will roll into 26.
Yep.
Okay,
Think of it as encumbered to
Yep.
26.
okay.
Perfect question. Any other discussion, questions? Hearing none, all in favor of HH2?
Aye.
Any opposed? HH2 carries. And we have one more, authorizing the Chair of the Legislature and the Commissioner of Social Services to enter into a contract with Cayuga County Department of Mental Health for the provision of community detention and respite-based mental health diagnostic assessments to children and to make recommendations for treatment.
I'll move it.
I'll second.
Thank you.
So this is a contract that we're asking to renew for another 3 years. This is something that Cayuga County Mental Health has provided to us. Comes in handy when we have the family court looking to ask for a diagnostic. We can do it community-based instead of having to look for a residential-based diagnostic, which is something that we used to do more heavily in the past. The rates have remained the same, so there's no increase in rate. We do not use this a ton, but it is something that is nice to be able to have to utilize when needed.
But this doesn't have anything to do with the qualified assessment. That's a whole different animal in terms of qualifying for residential. This is to the court and we keep them at the lower level of care.
Diagnostic assessment.
All right.
Any other questions, discussion? Hearing none, all in favor of HH3?
Aye.
Any opposed? HH3 passes. Thank you. And an update
I don't have a ton of updates. Our homeless numbers are pretty steady. Last Friday, we were at 20 families and 96 individuals that we were programming for, through shelter and through, transitional programming and through the hotel placements. So we've come back up and we're kind of staying steady again.
What was the singles again?
96.
96.
Mhm. So under 100, but not down in the 80s like we were a little while ago, a couple months ago.
The families over the year have definitely dropped. I remember numbers of 36 and 31.
We have had some success in the transitional program for families. So some of those families have been able to obtain permanent housing, which is nice. And been able to move out of the emergency housing. So that accounts for some of it. Waiting for, to be able to utilize the rent arrears program, the rent supplement program, and we're trying to, anything that we can get that's coming in for allocations, we will, be utilizing to try to help again.
I was at the meeting Monday at the City Hall for the Micron Housing Committee meeting, and they were updating on all of the opportunities that are going to be available through Housing Visions, 96 or 197 State Street, then the Barber Street. And then I asked Stephanie from Auburn Housing if she thought that getting some of those units back in service that are being rehabbed would help with the numbers of homeless families that you're serving. And it was an interesting conversation. She was like, I'm not sure. They may need so much supports. And I guess you did a very good job evaluating, the expenditures you made for Code Blue. Do you think it's worth looking at those particular families and how recurrent they are? I mean, is that probably true that these are very hard families to get housing for?
I think it's a mix. I think there's some that are very complicated because of their individual situations and their needs. And then there's others that just, some of it is maybe their background, that they.
Rentable.
Yep. And then some are just the housing market with being able to have enough money to be able to afford to get into a rental. Yeah, it's hard. It is hard to say. I mean, I would love to be able to say that that would be an awesome opportunity for folks, but I don't know that if that's going to come to fruition.
That was her sense as well. And that's probably why the community health networks, being the landlord, made so much sense, because they got people apartments because the landlord was listed as that community-based organization.
For transitional.
Yes.
Yes, for transitional, which isn't long-term.
Right.
It's not supposed to be long-term. And that, right, that does with supportive services, with someone paying attention, I think that you can see more success, and then it's going off to transition to
Something more.
be more independent. Yeah.
There may be a subset of families that we struggle with for a while.
Mm-hmm.
Yep.
I didn't really have anything else that I wanted to bring up today. There's things that we're definitely working on. We've been working on our child and family services plan to update the state around the different areas in child welfare, and adult services, domestic violence work that we have, just like how things have gone over the last year, and set out some goals for ourselves for, the provision of services to families for the next year. So working on that hasn't been submitted yet. Working on info for our budget preparation. We also met with Amanda O'Grady to talk about the RFP process for a number of our contracts that are coming up for January, and gave her some information about scopes of services for, I think it was 5 or 6 contracts, some of our larger contracts that'll be coming up in January.
Great.
We're working through that.
They've never been really RFP'd. A couple of them have.
A couple of them, but not a lot of them. So we'll be getting into that process of issuing the RFP and then evaluating those. Still awaiting information really on a lot of the changes, the federal changes through the Big Beautiful Bill Act, to see, as that information comes in, how it's going to impact us. But honestly, I don't have a lot of updates or new information on that right now. That's been the main things.
How are things logistically working out at 63 Genesee Street? Did there continue to be ups and downs?
Logistically,
Yeah, like the day-to-day work.
yeah, so
Having things work. for you.
yep, the day-to-day work. I mean, so I think that everyone is integrated being in and everybody's kind of gotten into the groove. I feel like people know where to find us. They're coming into 63 Genesee Street. I think that there continue to be, just some things that we need to work on with the building situation, some different things that we're encountering with the building that we're working through with the landlord and our own buildings and ground staff. Working through some logistics with security, some things that have come up that, may be that, needs to be looked at a little bit further about how we're going to handle some things that have happened. But I think, we've been in there, public has been coming in since June. So we're talking about 3 months essentially that we've had the members of the public coming in for services at 63 Genesee Street. And
And you see them pretty acclimated now to the change.
our staff,
Down, the public who need to.
oh, yeah, I think that, I think that
They
they
found
are,
their way.
they're finding their way. And I think that having staff together, as far as logistics of that,
Yeah.
the big payoffs with having everybody back together. The teams back together, being able to meet with staff, provide supervision in person. I mean, I think those were the things that we really were missing and are glad to have back.
Good to hear, and certainly hope we can resolve some of these building issues.
Me too.
Pretty big nuisance. I understand it. Okay, thank you. Okay, next up. One Wall. Director of Mental Health. And resolutions as well. Why don't we take a look at those first? HH 4, 5, and 6.
HH4 is allowing us to establish satellite locations within some of our school districts. I think there was a resolution in the past for a specific district, but this allows us to be able to do multiple satellites depending on what's going to happen with some of the grant work that we have. So this is really, we're really looking to create a satellite in the Moravia School District. I've been talking about that for a while. There's no exchange of money. It's just an extension of our clinic. We're able to bill all insurance companies, just like we do at the clinic. It would just be located at the school district. OMH also identifies certain districts as high need districts, so there could be some startup funds attached to it that we would receive. I think it's $25,000 per district just as startup funds that we would receive. But this is really to allow us to be able to do the satellite work.
In any school.
So right now we have a satellite in Union Springs and Weedsport. Our goal is Moravia, and then there could potentially be others based on some of the work we want to sustain through the grants, the SAMHSA grant that we're doing right now. So that would include Cato specifically.
So we'll put this on the table. I'll move HH 4. Second. So essentially, the resolution allows you to move forward without coming back to us
Correct.
with resolutions for each individual school district.
Right.
I guess any concern with how often the satellite would operate based on you have some staffing issues right now?
So my update on the status
Okay.
issues is we only are going to have one open position, social work position.
That's great.
As of probably, all depends. One person is, it's our internal person. She received her limited license and takes her test. So she'll be able to start, she just has to apply and go through that civil service process, but she would be able to start probably within the next couple of weeks.
If the SAMHSA grant is the DBT grant and you're worried that you might not get it again, the satellite clinic allows for revenue for you to keep DBT in the school, even though it's not direct clinic service? Is that what you're hoping for?
No, like we would still be seeing people and doing individual DBT, but we can bill for that with the satellite itself.
So it could be a clinic billable visit,
Yes.
DBT, individual, but at some point you were teaching teachers and
Yeah, I mean, we would still, like, obviously, we would love to continue the training and the work that we're doing, but that would be I think we'd have to have some agreement with the school about unbillable time for our therapists in the schools if they wanted to continue that work. So that'll be part of our sustainability plan, as the SAMHSA grant comes to a close.
These particular children would need a doctor referral, just like at a clinic.
Yeah, I mean,
Right.
they would,
Seek that out if the kid.
yes, so they would be able to,
Consenting, yep.
so they would be able to see any of our medical providers at the clinic, as part of the treatment team.
Oh, so it's more in social work. It's more than just social work. You'll.
Yeah, I mean, they're open to the clinic, so they can see our medical, or for, if they need medications or anything like that, they can see our, medical providers as well. It may not be in the school, but they would be able to see them at the clinic or virtually.
Yeah, I didn't know. I guess I wasn't sure if you'd have medical providers and social workers and a whole little, no.
No, just the therapist and
And then they would access the clinic.
they can receive all the other services that we have.
Okay.
Like, yeah.
Okay, we have this on the table. Any other questions? Or discussion items? Hearing none, all in favor of HH4? Aye. Any opposed? HH4 passes. HH5, authorizing the mental health department to transfer of funds to cover psychiatric care. So if you can.
So this
Give us
is,
some
we had
explanation.
2 people, ordered competency examinations, were deemed incompetent, went to the hospital and have returned to the jail. So this is just covering those 2 people. So we're moving from some of our salary savings, we're moving that to a different line and within our own budget.
So I'll move HH5.
I'll second.
So and that is what the decrease in salary funding is, a full-time position because of your savings throughout the year.
Well, yeah, because we haven't been able to fill some positions that we moved it from that line to
Okay.
the,
We would have gone to fund balance, and if you could make it
Yeah.
whole in the budget, then you did.
yes.
Yep.
Thank you.
Makes sense.
Questions? All right, hearing none, all in favor of HH5? Aye. Any opposed? HH5 carries. One more. HH6, which authorizes the Director of Community Services and the Chair of Cayuga County Legislature to contract with Nick's Ride for peer support services funded by the regional abatement dollars from the opiate settlements.
Yes.
Put this on the floor, I'll move HH6.
A second.
Could you tell me again what regional abatement dollars are?
Yeah, so,
Money coming to the county or?
so this is the money that came directly to the LGU through Oasis.
Okay.
It's not state aid dollars, it's opioid settlement funds, but they treated it almost the same way to the way it trickled down to counties. So this is the LGU money. We currently had some existing grants through, the BGA grant was a 3-year grant that's ending at the end of September. And then Nick's Ride also had a grant through Oasis for street outreach that's ending at the same time. They had, attempted to apply for some new grants to sustain some of this work. Unfortunately, they did not get those grants. So we talked about how we can sustain a lot of this work. You know, they're doing a lot of peer work at CPS and foster care, the CAP arraignments, post-release from jail. And obviously they're helping a lot of people. So the goal has always been that they would be able to bill for their services, and they have started that process. But it kind of takes a while to kind of ramp that up to be able to bill for all of the people that they can. So they started in January. I think that's like tripled. August was like triple the amount they billed for in January. So I think the goal is that we'll do a 1-year contract. And any money that they bill Medicaid for would just, we would just decrease the amount that we're funding them. But the idea is to make them whole with this contract.
Medicaid's the only third-party payer? Sorry.
Yes.
Yes, okay.
And you have actually set up kind of a monitoring system
Yeah,
to see if their
Ashley's here too, if anybody has
expenditures
questions, but
align with.
the idea is that we'll meet regularly, so we know where we're at as far as the billing of Medicaid and whatnot. So that way we have an idea of where the contract stands too.
This is just for the startup year after,
This is for 1 year, and then we would evaluate as the year goes on and we'd see
and what happens with Medicaid and
a year now.
you can bill for.
So we'll see where we're at.
Okay.
I mean, before a year, we would know what's going on with all of that, hopefully, and then we can adjust. We do have more funding as far as opioid settlement funds, so a lot more. So I think this is a really good use of that money though.
Good work.
Okay. Any other questions, discussion? Hearing none, all in favor of HH6?
Aye.
Any opposed? HH6 passes. report for us?
I updated on the staff. That was one thing, which was a positive one. The other one's not so positive, but I do think you should know. So as far as the competency examinations go, we do have one person that was deemed incompetent. However, there was a court proceeding where all the doctors had to testify. I reached out to the court as I haven't heard what their determination is, and the judge still has not made his determination. So he really has the last say of whether that individual goes to the hospital or not. So I don't know if that person will go or not, even though she was deemed to be incompetent. It all depends on like the charges and what the judge wants to do. So I'm still waiting to hear from that, but we do have another person that was also deemed incompetent that we're awaiting either court to decide or that person will go to the hospital as well.
This is kind of hypothetical, but are you concerned with some of the change, if people aren't able to get services and go to their doctors, are they gonna end up in the jail? And then this is more costly route, right?
So I will say over the past 3.5 years since I've been in this position, we have seen a lot more people with significant mental health issues in our jail.
It's way more expensive if they get the doctor.
Yeah, but I think the whole system is really flawed. I mean, this individual that was deemed incompetent was not in the jail.
Right.
Oh,
In the community.
Did not meet criteria to necessarily
Person still in the community?
yes, does not meet the criteria to be hospitalized otherwise. But yet because of the competency examination and the forensic bed, they would go possibly.
Because the courts, if I understood what you said before, the court's goal is to get them competent enough to answer to the charges and stand trial.
And then serve
If
their,
that's possible. So these are community people who,
I would say 90% of people are in jail when it's ordered, but there are some that are not, they're out on bail or whatever it might be, and they don't meet the criteria to be hospitalized otherwise. It's really
yes,
not
How do the specialty courts fit into that? Like, could
so
they?
they could, yes, they could. There's a lot of, I think, creative
They could be
ways.
competent but go in the specialty court, but if they're incompetent, then the only places.
If they're incompetent, then the judge has to make a final decision whether they need to go to restoration or not, to
Got
be
it.
restored to a competent level. If that makes sense.
So these two cases, as we review 2025, are they the only two cases or have we had others?
So we
earlier in
had,
2025?
so the resolution that I just did was we had two people go for a pretty short amount of time. So that's the extra amount that we're moving in our budget. Again, I'm not sure, even though they are incompetent, doesn't necessarily a given that they go to the hospital, but the judge really has to make the decision. So we have those two and we only have one more pending. So that person has not met with the doctor yet. So I don't know where
Get
the,
arrested or go to the hospital in the meantime, right? And like any number of things could happen.
and you've already spent the 125,000 that we put in
it
your
was,
budget.
was it
100?
110?
Okay, so now this 56 is added to that. If you have two more go, you'll be back again, potentially,
Potential.
pay the bill.
Yes. I do think though, I mean, this year's
Less than, for sure.
a lot less than last year. So yes, but again, no control over it. It's the doctor's decisions when they meet with them, whether they are or not. So, but again, we'll see what the judge does on the one case specifically. The other one, we'll see too, because I think more than likely she would go though. So we will see. But I just want to update you guys as well as where things stand, because we could
Look for
potentially come
the
back for
potential
another
costs, yeah.
resolution. Yeah.
Yep. Thanks for answering all your questions.
Thanks for the good news.
Yeah,
I would have given you the
No.
numbers last, but you.
Yeah, I know. It's fine.
thank you, Lauren.
Yep.
Kathleen Cuddy. You also have three resolutions. Let's pop to those first. HH 7, 8, and 9. All three of these are resolutions that relate to our mandated lead registry program. Through New York State public law, there's funding and actually a funded mandate,
Correct.
fortunately.
Fortunately, yes.
Yeah. So HH 7 is authorizing the public health director to create and fill a community outreach, education, and partnership coordinator for work on the lead registry program.
I'll move it for discussion.
Second.
So the way we have this structured, we're really happy that we do have $500,000+ a year in grant funding.
I'm sorry, Kate, did you already accept that?
We accept
Yes.
that money already.
Yes,
Yep.
all right.
the grant funding started earlier in the year, but we really were waiting to create and fill these positions because we needed to learn more about how the program was going to be executed. Now, this mandate, as we talked about before, is just for communities of need, and there's 20 of us within New York State. The 13021 zip code is a community of need. And it has to do with age of our housing stock and the number of children who have elevated blood lead levels. So State Department of Health passed this law because they have identified that really it's policy change that's going to make permanent differences. So the way this law is set up, we need to, health departments are tasked with performing the work of it. So the state's giving us money because they know that we need money to have people to do the jobs. So they've been very generous in the amount of money that they are giving us as communities of need, and we need these positions. We've created them strategically, both to open it up to as wide an audience of eligible people as could be to perform the work that needs to be done, but also to be looking ahead for needs within the health department, and how can some of the work the technical work that needs to be done eventually build someone's experience that they might be able to move up within the department at more technically complex roles within our environmental health division. So this first resolution is a request to fill a community outreach, education, and partnership coordinator who will help with supporting the program and educating the members of the public, and particularly the property owners that will be impacted by this law.
I know that this is mandated and through public health law, but I think it would be helpful just to include or make an amendment. I'm going to offer an amendment to add a whereas, and this may be a friendly amendment, Fred, to abolish the position if the New York State program ever ceases or the money ceases to flow, so that we, can be responsible about not building a bigger government when we don't have the.
So you wanted us a whereas and a result.
Correct. Did I speak clearly enough so you have the language?
You did, yes.
For that kind of, okay, because I'm going to ask for that 2 more times as we go through these.
Understood.
Okay. I'm just curious about what the qualifications are for this individual and how likely we are to be able to get people on board. Are you looking for folks at a master's level with a public administration or public health background, or a generalist bachelor's?
I love that you're asking that question. So this is similar to what we would ask of a public health educator, but a public health educator education formal requirements for the job are set in state regulation. So we deliberately have written this to have a variety of backgrounds. Specifically, and it just went through our civil service process. You certainly can have a college degree. We love that because right there shows people have great writing skills, usually good presentation skills, things like that, and some experience in community outreach, education, organizing. But we recognize that a formal degree does not mean that you still don't have those organizational skills and those ability to engage the public. So you could have an associate's degree in education, public health, health sciences, communications, or a related field, and 3 years of experience, or an equivalent number of credits as would be associated with an associate's degree and your high school diploma, and at least 3 years of experience in those areas. So if someone has been working in a field where they truly have engaged with the public quite a bit, they provide educational material, right? Then this may be a good opportunity for them to look and consider the duties of this job.
I love the open-endedness of it because It's the kind of position that potentially can keep a new college grad in the community.
That would be wonderful.
Okay. Any questions or discussion about H87? Any further questions, discussion?
I think we need to move it first
Oh,
and then do the amendment.
Okay, I'm sorry.
That'll catch me up.
All right, I'll move HH7.
I'll second.
So
Is it? And then amend?
I would like to-
Amendment next,
okay.
is what you proposed.
I'd like to move HH7 as amended.
Well, if I could just stop. So you're going to move the amendment first, see if there's a second.
Oh,
And
okay.
then take a vote on the
Right.
amendment and then go back to the resolution, presumably as amended.
I'll second the amendment in regards to adding additional language about funding
Yes, both in a whereas and.
and a
as
resolved. Yep.
Is that first
So we
and
just need a
second?
vote on the amendment.
Yes.
All in favor?
Aye.
Yep, all in
Right.
favor of the amended
Amended.
resolution?
Aye.
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 Any opposed? The amendment passes. A motion for the resolution as amended.
I'll move it.
Second?
All in favor?
Aye.
Any opposed? And HH7 as amended passes. Thank you. HH8, looking at something similar regarding the New York State mandated and fortunately funded mandate. Again, the lead program, the lead registry program, and this is to create and fill a lead program manager.
Correct.
And again, using the health program.
Correct. Yes, that will get, right, well, I'll talk about it after too.
I'll move that.
Thank you, and I'll second that.
So this position really will chair the programs, right? Lead this lead registry program, help get it off the ground. Again, we tried to write the qualifications to be a little more broad. This role definitely needs some supervisory experience and also work in accustomed to field work, right? Because what we envision here is that this role will not only get the lead registry off the program, off the ground, the lead registry program, but eventually we may be able to integrate work within some of our other lead poisoning related programs that are required of the health department and really have better facilitation amongst all the programs that could allow some of our, like our directors to, our deputy director or our director of environmental health to not do as much day to day in these programs.
I have a question. How did you get them all help classified? I thought you had to go through this whole process for a help position.
Our civil service office made this recommendation to us. They've been in conversation with state civil service
Okay.
that it's recommended right now to
Okay.
try and do that because they see recruitment where it has issues in every area.
And after they pass their 1 year and they're permanent, you'll have to come back and use the same funding to create a permanent job?
Yes. And so we did the paperwork on the civil service side already, but then we'll have to come back.
Okay.
Do whatever.
Just like in the other DSS positions. Okay.
Do you hire this one first or all at the same time?
We want people as soon as possible. It'd be ideal, right? You want to have the program lead first would be ideal because that person would then help interview the other hires. But if we get applications of some, we'll
Yes.
get them in and we'll get them going.
I am going to, again, add some language, an amendment language that would follow the amendment language of HH7.
I'm going to speed it up and ask that you're asking for a friendly amendment.
Yes.
See if there's any objection.
Correct.
Take that as everybody's on
Yep.
board.
All in favor?
Aye.
Aye. So with a friendly amendment, Fred, do I need to do the motion for the amendment and then the motion? for-
I think that's neater, cleaner to do it that way than
Okay.
have a final vote on the
Okay.
resolution as friendly amended.
Okay. So all in favor of HH8, the amendment to HH8?
Aye.
Aye.
Aye. Any opposed? That amendment passes. All in favor of HH8 as amended?
Aye.
Any opposed? And that passes. Thank you. HH9, we're going down the road here in terms of all of the folks who will be involved in our lead rental registry. This is 2 environmental health technicians.
Correct.
Same money source, same local law, same mandated work.
That's correct.
I'll move HH9.
I'll second.
These roles were specific years, a number of years ago, the local health department, our health department had what we called public health technicians, which are
Entry level, right?
they're, yes, that you have to have an associate's degree in the science credits. That's set in regulation. Where at the state level, that job title is, we're working to morph that into something that's more clearly identifiable. Public health technicians are now being called environmental health technicians. So there's state regulations for environmental health technicians, and what we envision are these positions are the ones who will actually be out in the field, performing the lead assessments, performing the lead testing out in the field. If we are able to attract candidates to these roles, and they work for a couple of years with us, then they would then become eligible for sanitarian positions. The sanitarian positions, their job titles will eventually be morphing into environmental health specialists. But anyways, it sets things up kind of as a feeder program for our mandatory environmental health work. And we really see that as a good thing, meeting the needs of our lead registry program, queuing them up for potential promotion into the sanitarian positions, and then ideally being able to, get some more entry level people to help in the lead program.
I am again going to ask for a friendly amendment to add the language of whereas and resolved regarding abolishing the position should New York State funding cease.
And no objection to that.
No objection.
Thank you.
So, as you said, just to be clean, I'm going to ask for a vote on the amendment. All in favor?
Aye.
Any opposed? The amendment passes. Any other questions? So, can I ask for all in favor regarding HH9 as amended?
Aye.
Any opposed? And HH9. Thank you.
Then they all go to Ways and Means.
Yep.
Yes, updates for you. Community health assessment, we're still looking for people to answer. Please get the word out. We're working with partners, but we're not getting the quantity of response we would prefer.
Did you just hold up?
The needs assessment.
This is our,
Oh, needs assessment.
Yep.
Yep, gotcha.
and
When are you taking them through?
probably the end of the month, most likely. Yep. Some good news, Rosalind Fagan, who's our director of our fiscal manager, our finance person within the health department, was presented with New York State Department of Health Public Health Works Honor Roll Award. We presented her that came from the State Department of Health. We gave it to her at our Board of Health meeting in August. I think we don't always talk about the programs that aren't either revenue generating or grants that we accept grants into. And our fiscal division is amongst those programs that are so vitally important. And one of the things that we had commented in her nomination was not only is she our specialist in doing claims for our early intervention in our preschool special education, and she is now teaching others, this very complicated process and reimbursement process, because it's very highly regulated from state ed and state health. But during the pandemic, it was Rosalind herself who brought in, because of her billing, more than $400,000 to the county in billing for administrative fees for COVID vaccination clinics. And that's nothing to sneeze at, right?
Yeah.
That was good. But I'm glad that we were able to recognize her in that regard.
That's great. Please send her the regards of this committee as well.
I will. I definitely will. This is a feel good that I'll pass around. through our health education office.
Joe's book, yeah.
Megan Nicole
Yeah.
as a senior health educator. And she wrote this book as part of our bike and wheel sport safety, or pedestrian and wheel sport safety. And it's clever, it's cute, and it highlights Joe Mushak, who's been our injury prevention coordinator for years. So pass that around so you can take a look. And if any of you might like a book for your collections or to share with people, we're happy to facilitate that.
I would love one.
Good. Well, you can keep that one. And then
Okay,
we can
thank
get you
you.
another. Yes.
I'll pass it around so you can say it, because I'm going to keep it.
It's really clever. It's cute. It's very cute. Our IT department helped us in our transition. Now our emails in the health department are cayugacounty.gov. I think this was interesting. I had seen this when I was watching the nightly news last week. And we've been talking about how we blew through our rabies budget already, and we're going because both for post-exposure prophylaxis, both for submitting specimens for testing. Around the nation, there's an increase in rabies. And this NBC News had a segment on their nightly news, national news, that I thought was very interesting and highlighted, some other states around the country where this is an issue, but it's very much everywhere.
And you're still looking for those specialists, those
Specimen preparation.
specimen prep people?
Yes, we are. And I can't say, there's a lot of flexibility in what we can do with that. So there are people, DEC wildlife specialists, veterinarians, people who work in animal protection. There are stipulations around who can be a specialist, and I'm happy to share more of that with people. And if anyone just has a little bit of interest, please call the health department and we can give them more detail. And like I said, be very flexible with when they're available and et cetera.
So typically, like, an idea would be to talk to ones that, are you,
Correct.
do you mean that sort of outreach to
We
get?
can, yes, well, we would love veterinarians to be willing to be specimen preparation people. But if you know someone who's a wildlife trapper and wants to, may have interest in learning more about this, send them our way. We'll talk with them because it may not be too difficult
Need
to get
be
to
a
that
highly
point.
trained, highly educated.
There's,
I know.
it's a lot of.
You should tell them.
It's a lot of infection control, right? Because you're dealing with
Right.
potentially rabid animal.
Right.
And having the appropriate space to perform the work that's necessary to send that specimen off to Albany.
Is it per diem, like timely, like if somebody has a bat in a barn, you have to go to a certain amount of time, or do they do it like, how flexible of a position?
Well, so a lot of times we'll get bats. Someone will call us overnight. They kept great. They'll bring it in the next morning. We try to get it prepared within 24 hours of capturing it and send it off.
It's not like on call necessarily.
No, but if someone is willing to be on call, we're open to that also.
Okay.
But we wouldn't send someone out in the middle of the night ordinarily. Ordinarily, that would not happen. But there's always oddball stories when it comes to rabies. But that's the nice thing about being a contractor. You can decline that particular thing, but you can say yes also. So
Spread the news.
spread the word. That's right.
This has been
We
Yeah.
problem
need,
for us to get these contractors. Great.
so we talked about the lead registry quite a bit. So I won't review that. I had included a graph and I had done that when we were really in anticipation when we look at session planning and our staffing. We were working with some other numbers, and I think that this bar chart, it's a good illustration of, a third of the health department is eligible for retirement at this point. And that's, that includes supervisors and frontline staff. That doesn't mean they're going to jump into it right away, but I do know that some people, have been forthcoming about their intentions and the time frame that they're looking at. So
So we have to
it
do
helps.
some serious thinking about
Planning ahead, yeah.
Planning out.
secession.
Yes, and recruiting and retaining. We had, I'm just saying this as an illustration during the last round of the freeze on hiring positions. We had been contracting with a recent college graduate. She had a master's degree from Cornell University in public health. She wants to work in Cayuga County. She's from Cayuga County. We couldn't hire. She got offered a job in Tompkins. It's more money. She went to Tompkins. She's staying there. And boy, we wanted her because she wanted to be here and she's good. Right. So, you know, those are things we need to think about when we are, when we're looking to hire people and we're looking to retain people, right? We need to get in and find a way to keep people. We were just looking at just our own turnover within our department thus far. And, you know, sometimes it feels like we have more because we've had some temporary leaves, right? So sometimes it feels worse than it is. But we had probably 3 people who didn't stay for a full year within this year. And that's, you know, it's a lot of orientation and investment and then they leave. And that's,
Is that in positions spread throughout the department or a particular program that's hard to?
well, that's, you know, there were a couple different programs that this was within and, you know, opportunities are out there for people, but this is something that, you know, we rack our brains with. And I think part of us is we've got to find ways to recruit better and because I think they're great jobs, but we know that people aren't coming to be lifers anymore. Right? They're not typically coming to make their entire career with the county.
We do exit interviews,
We do.
and is that what they're going to different industries,
That has been, you know, one of the people, I had actually been a contractor during the pandemic and then became a fellow and then became an employee, but then looked for other opportunities. And I said, you know, I can't fault, they were with us for 5 years. And they're in their 20s,
right?
right? It is time to do something different if that's what you want to do.
But it was quick movement and then it
But
stopped.
I was like, oh,
Yeah.
I'm like, darn, you know, we wanted you to stick around a little longer, but no. So they're not leaving out of a distaste for the work or their colleagues, right? Which that would make a difference too, right? But
Competition and life change and
yeah,
the idea that indeed, we're not in a generation anymore that expects to make a career in one place.
that's exactly,
Oh, it's the next thing and remote work, you're competing. I mean, it's just everything looks different now.
that's right. That's right. You know, and then,
And I appreciate this heads up on the 1/3 eligible for retirement.
you know, I think about just a couple years ago when we had all of our directors turnover.
Yeah.
And we saw that coming at us and boy, that was hard. That was hard. And it's still, right, we're still leveling out from that. But this is one more thing to be looking for. A few other things. State Department of Health issued emergency use authorization for COVID vaccine for pharmacies. And that came out. So now pharmacies are able to, in New York State, are able to provide COVID vaccine if they so choose to. The pharmacist can give that. The challenge right now is attaining the vaccine.
Okay. Do you have any information about our local pharmacies' access to the vaccine?
We don't yet. That was part of our discussion that we had around our state organization, ISHO, and I expect we'll hear more within the next couple of weeks.
Yeah.
Yeah.
So essentially that order or law that Hochul invoked allows the pharmacist to basically write the prescription.
Right. It opens it up. There's still, the federal government has stipulations. You see, it's pretty broad stipulations for who's eligible as an adult.
That was the question, if healthy children are now going to be excluded or whatever it is, does that mean that they can't bill insurance for it or they can't pay out of pocket for it, or it's just not available to them? That's the thing I'm not
You
understanding.
can always, so if I were a minor who, my parent, you know, I want my child to get the vaccine. Your physician can write a specific order for you to get it, and that's acceptable. But you hit, one of the questions is, will insurance pay for it? or not?
Right, if it's not under the covered category, then
And that's questionable.
it's unknown yet.
Probably not. They will probably not, but to that point, part of the discussion was, if we're able to get vaccine. If your child cannot get it paid through insurance, then you're underinsured. And therefore, you may be eligible through the Vaccine for Children program, or as an adult through the Vaccine for Adult program, if you are within the correct stipulations.
I didn't realize you gave COVID at the health department. Vaccines.
VFC and VFA. We
VFC.
don't generally, we haven't.
Yes, because it's been,
Because it's very expensive.
and available.
And it had been available. But that's something that's really being assessed is how available will it be? And, you know, what's the cost? And right now it's kind of a moot point because nobody has it. Nobody has it yet. So we'll have more, I'm sure, to share about that. I think it's important to be aware that, you know, we monitor the drinking water, right? This is not news for anybody. Auburn and Owasco Lake. We monitor at Wells College too, but it hasn't been an issue there. I say Wells College, the Village of Aurora intake now, they're operating the water system treatment plant. The HABs have been identified in the raw water, but has not been an issue in the drinking water. The treatment systems that Owasco and Auburn are using are effective. And we do post onto our website, if people have interest in seeing it, what those readings are routinely. And then we'll leave on a high note here. We got our first, which actually was a 3-part installment of our Jewel funding. So there's Jewel settlement funding, as you may remember, that the Attorney General had been part of a suit against the manufacturer, the vaping manufacturer Jewel. It's the settlement worked out to provide some money for school districts in New York State and local health departments in New York State, and then the Attorney General's office as well. And we were happy that we got the first installment, which is $149,000. So we talked at the time, there's 8 installments. This first installment was 3 in 1, right? So there's 5 more years that we expect we'll be getting each May or June, another installment proportionately. We have not started working on our plan. There are, you know, restrictions as to how we can utilize those funds. We're going to get through our required, you know, our mandatory community health assessment and community health improvement plan, and then we'll turn our resources to how we're going to make use of this funding appropriately. But it's great we got the money finally.
Yeah.
So I was glad for that.
Lauren, did you hear she left? She's ending on a high note.
I
learned that actually from last time, I think from you. I picked up on that one.
Thank you very much.
Thanks.
All right, I would like to ask for a motion to adjourn.
I'll make the motion.
I'll second.
And all in favor?
Aye. It's good. I wish we still had a